Hi, Dr. Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for parents. Today we're going to talk about understanding the growth charts a little bit. Please remember that these visits do not replace visits to your, or these discussions don't replace visits to your physician. If you have questions, if you have concerns, we're more than happy to see you here in our office. We'll see you same day. But we can't really discuss this over the internet or over the telephone because internet medical care is bad medical care and we don't want to harm somebody. So if you've taken your child to the pediatrician, you've been told about, he's at the 5th percentile, the 10th percentile. And what exactly do those numbers mean? Where do these growth charts come from? Well, there's a couple of growth charts that are in existence. There's one prepared by the World Health Organization and another one prepared by the Centers for Disease Control. And, I'm sorry, the National Institutes of Health. And what they do is they take and they divide children up into boys and girls. And they look at several thousand normal healthy boys and several thousand normal healthy girls at several age points. And they just plot where they fall in terms of the normal range. Okay, and then by plotting that out, we can look at where an average child is. An average, by definition, is the 50th percentile. And then we look at how, if you like line up all the children in your child's class in grammar school when you walk in and you separate the boys and the girls, you'll see, there's a couple of really short kids, a couple of really tall kids, and most kids are somewhere in the middle. Well, we do the same thing both for height, weight, head size, and your measurement of skinniness or fatness, body mass index. And so we can look and say, if we had 100 children who are girls, or boys if we're looking at a boy, at your child's age, your child would be bigger than, at the 50th percentile, 50 of them, and smaller than 50 of them. As your child gets taller, the 75th percentile, you would be bigger than 75 out of 100 normal children, your child's age, and smaller than 25 normal children your child's age. By definition, we're looking only at normal children. Children with metabolic problems, children with genetic problems, children with short stature are eliminated from this equation. They are not part of the data set. Okay, so then who is abnormal? Well, anybody between the 5th percentile and the 95th percentile is considered normal as long as they're not crossing percentiles up or down by more than 5%. If you're crossing up by 10% or down by 10%, we start to get worried. But if you're following on your percentile, we don't pay too much attention to it as long as you stay on that percentile. The higher the number, the bigger your child is, whether we're talking weight or height. So 95th percentile is top end of normal for weight. 5th percentile is bottom end of normal for weight. Now it is important to recognize that 5% of normal children are bigger than the 95th percentile and 5% are smaller than the 95th percentile. But we have to watch those children very carefully, and we have to be very concerned that there may be more going on. But as long as all things stay where they should be, and that's why we have close follow-up with the pediatrician in those cases, we can continue to watch that. But, the nutshell definition for you as a parent when the doctor starts giving you percentiles is, if there were 100 children of my child's age lined up, where would my child fall? How many would be bigger, and how many would be smaller? And the number that we give, the 7th percentile, the 9th percentile, the 100th percentile, is how many children would be smaller than your child if we had 100 normal children lined up of the same age. It's important to realize that these are not matched for race. They're not matched for financial status. So rich children, poor children are all mixed in. However, they are, specifically the NIH charts, are all Americans. And they take a mixture of children of all races. But that can skew things if you have a child who is a single ethnic minority race. And the charts do sort of fall off. For children who are born premature, for children with genetic problems, or chromosomal abnormalities, there are special growth charts that we use that have been similarly obtained and similarly prepared, but with children specific to that. The growth charts do take into account the fact that some babies are breastfed and that some babies are not breastfed, and the growth differences between those babies, and accounts within the normal range for both. So a breastfed baby and a bottle-fed baby should both be falling within the normal range on the growth charts. If you're falling off the growth charts, that can't be explained away by breastfeeding or lack thereof. So I hope that this has answered some questions for you and demystified some of what your doctor's talking about. If it's raising other questions, let us know. Perhaps we can do additional videos to help explain that situation to you a little bit better. In the meantime, if we can help you here at our office, we're happy to see you same day, 775-359-7111. We'll see you next time.